work in Medicaid administration in Massachusetts, and they have a phenomenal program. They have especially the fee-for-service program. So I like the Medicare for America thing, but I spent years in fraud, waste, and abuse, and now I'm in a program that I have to admit I have a job because Medicare doesn't know how to do its job. Because they mess up so badly, like we audit and find out how they've overcharged people, overcharged states for Medicare buy-in. So I've seen it work really well, and I know the government messes a lot of things up and people want deregulation, but it's a tough question, so I'll just ask quick yes or no. Would you consider turning Medicare into a not only single payer but single administered and administered by the government program?
I'm going to have to give you a longer answer. Sorry. Trying to find a way to do this. So the proposal to ensure that every American is guaranteed world-class care, as we were talking about earlier, involves ensuring that everyone who's not enrolled in any healthcare plan today is immediately enrolled in Medicare. Those who are insufficiently insured, meaning can't afford their copay or their premium or their deductible, they can elect to move into Medicare. And that those who have employer-sponsored insurance or members of unions who tell me that they fought for their health insurance plan, they like it, it works for them and their families, they're able to keep it. So universal, high-quality, guaranteed care, the operative word, because a lot of people have health insurance and are not guaranteed the care because they cannot afford the copay. Guaranteed care while preserving choice is the path that I want to take. To the underlying concern that you raise of waste, fraud, and abuse within that program, I think as that program is enlarged, it adds ever more urgency to making sure that we're husbanding those taxpayer resources as carefully as possible. There are going to be more people who are cared for, more people who are going to be seeing that mental health care provider or going to see that doctor. I want to make sure that we are as effective and as efficient as possible with use of those dollars. Would love to have your help, given what you're working on right now, to guide us in that and others who know what they're doing in this space. But what we have seen is that Medicare, for many of the challenges that it has, is awfully successful. Its overhead rate is about 2%. Private insurers about 15 to 16%. So if we can squeeze that a little bit tighter, get a little bit better care and value for the taxpayer, I'm all about it and would love your help in showing us the way.
Absolutely.
Thanks for asking.